Everyone, and a very warm welcome to our open evening. My name is Praveena Pai. I'm one of the consultants, and it's really lovely to have all of you join us for this open evening. So what I'll try and do in this evening is to sort of take you through, introduce you to what our clinic is all about, what we do. So this presentation, as I'm taking you through these slides, there is a question answer session going alongside. And if you look at the Q&A button, you can click on that, and please feel free to keep feeding questions, because we'll be taking a couple of my colleagues will be taking those questions alongside. And then of course, at the end of it, I will join them as well. Okay. When the presentation finishes, there'll be a virtual tour of the clinic. And then there will be a link provided to you all to give us a feedback, because we find these feedbacks play a very important role in improving these presentations. And last but not the least, you're looking at that circle, there's a special discount which will come up at the end of the presentation. So please do stay with us, and there will be that big reveal at the end of this. So let's get started. So you have me, my name is Praveena Pai. Alongside, I've got Jackie McAdams, one of our senior fertility nurses who is taking those questions. And I've got our marketing and wellness chief, Mana, with us as well. Right, so here goes. So a little bit about the history of Herts Essex. It was founded as the Essex Fertility Centre. I hope you all can hear me well. So it was founded as the Essex Fertility Centre in 1989. We've got over 34 years of experience delivering about 7,000 babies. All procedures are performed under one roof. I mean, people say that that's one of the big things. You don't have to run around. Everything is under one roof, which is really convenient. And we've got this state-of-the-art purpose-built clinic in a really nice, quiet corner of Essex. The services we provide, so we've got fertility assessments, we've got advanced techniques such as IVF, ICSI, PICSI. We do less invasive procedures like RUI. We do fertility preservation, be it egg freezing, sperm freezing, embryo freezing. We run egg donation cycles. We support surrogacy cycles, our clinic being one of the leading surrogacy clinics in the country. We also take independent pregnancy scans and the Harmony test, also known as the non-invasive prenatal testing. So let's say you've had treatment elsewhere or you've become pregnant naturally and you're waiting to be seen on the NHS. If you just want to throw in a pregnancy scan, we're more than happy to accommodate that. We also provide some gynecological services, and there's some additional treatments like pre-implantation genetic testing. And I've got a slide dedicated to that, and I'll take you through a little bit more on these services. So the fertility assessments. So basically the three main ones. One is a couple fertility assessment, in which we look after both the man and the woman in a heterosexual relationship. So this involves 2 visits. In the first visit, both of you will come, you'll see a nurse, you'll have your BMI assessed, you'll have some bloods taken, the gentleman will have a semen analysis performed. Okay, and then we'll let you go, and then you'll see the consultant once these results are back, who will have a thorough look through your results. There will be a scan performed for the lady, and then we can have a chat about the fertility prospects and the next steps. Female fertility assessment just involves the lady, again, involves 2 visits. One visit to just have a look at the BMI bloods. Next visit is a scan with the consultant along with a discussion of the results. Male fertility assessment includes a semen analysis, and our clinic does a special test called HBA, hyalurone binding assay, which is to look at the sperm maturity. And once these results are back, the embryologist will call and discuss the results with you. Okay. We also do, as I mentioned, just standalone gynae scanning, which includes a 3D scan to try and assess what's going on. So this could be for reasons such as irregular periods, very heavy periods, and so on. As a part of the uterine cavity, we can delve a bit deeper. So not only do we do a 3D scan, we also offer some separate appointments like the saline infusion sonogram. And you can see in this diagram, when saline is inserted through a very thin, fine catheter, any disturbances in the cavity, like a polyp or a fibroid, becomes very evident, and that obviously we need to sort out before treatment can commence, because that can come in the way of an embryo implanting. HICOSY stands for histocontrast salpingography, which means that we are At the same time, when we do a saline infusion, in most instances, we also pass a dye, which then spills through one or both tubes, and then that gives us clarity about whether the tubes are functioning properly. So cis and high COSI are the two other appointments that we do offer. We do have in-house an operating surgeon in the form of Dr. David Ogutu. So let's say we do find a polyp or a fibroid, or let's say a huge ovarian cyst, which we feel that needs sorting before a treatment cycle can commence. Most of the times we'll give you a letter. You can try and see if you can sort it through the NHS. But if not, if the waiting times are too long, then we can get it sorted through Mr. Ogutu, who does operate sometimes in the clinic itself, sometimes in another clinic not so far. All right. So what is the journey of let's say a couple has come to us, or a single lady has come to us and she decides, okay, I want to commence a treatment cycle. How does that happen? So in the first instance, the clinic will set up some consents online, which you are supposed to have a look, complete. Okay, we will take some details from you, like the passport, certain relevant investigations will then be arranged. So you'll come in to see one of the nurses for pre-assessment. She will, let's say it's a couple attending, she will look at both of you, do the BMIs, do some bloods, including AMH and thyroid function. AMH stands for anti-Mullerian hormone. It is a way of looking at somebody's ovarian reserve. Thyroid functions we normally do, so we all have a thyroid gland, and we know that thyroid can have an impact on all our bodily functions, including reproductive function. Okay, so we throw in these blood tests. BMI is measured. It's important to mention that BMI, we've got a cutoff. If somebody's going to undertake a cycle of IVF, ICSI, for example, the BMI has to be less than 34. So we will encourage you to try and optimize your weight beforehand. Semen assessment is performed. And once all this is done, off the couple goes. Once the results are back, then a new consultation is booked, which we offer via Teams. So it's an hour-long discussion with the consultant with all the results, where she or he will sit down and have a thorough look at everything and make a bespoke plan for you. All right. So we have something known as Salve app, which I find couples find really helpful, because this is something you can download, and it's like a little tool which helps you communicate with the clinic no matter what time, where you are. It helps to remind you about your medications, about your appointments. It gives you some robust medical information. It's a secure messaging platform. So I know the couples and all patients coming through, they do like Salve. So that's something we will encourage you to download. Fit for fertility, I can't emphasize this enough. When you're trying to get into this journey, it is an arduous journey, and you want to put your best foot forward. Okay, so a healthy mind, healthy body, and we'll try and help you in whatever we can to try and get yourself in the best health before you begin the pregnancy journey. Right. What about screening bloods? So before treatment commences, be it IUI, be it a cycle of IVF or ICSI, both partners need to undergo screening via blood tests. So these blood tests include HIV, hepatitis B, hepatitis C, chlamydia, and gonorrhea. So that's both of the partners. And additional screening for the female is to do the AMH, like I mentioned earlier. That is to look at your ovarian reserve, and we also look at rubella, full blood count, and HP electrophoresis to pick up things like sickle, thalassemia, and etc. Okay, so what's important here, we try and keep these screening bloods as close to the start of treatment, because this should be within 3 months of your egg collection, otherwise they lapse. So we will try and organize it and make sure that things are done appropriately. So moving on to what treatments, as I said, essentially you're looking at it could be a cycle of just ovulation induction with timed intercourse. We do offer that for a subset. There is something known as intrauterine insemination, or it could be an IVF ICSI cycle. So what is intrauterine insemination? This is a procedure whereby the healthiest available sperms are introduced into the womb. IUI is used to aid pregnancy in certain situations. It could be used in heterosexual couples where the couple is finding it difficult to have intercourse. So it could be because of female vaginismus, or it could be because of issues with erection or ejaculation in the male. Right. This is a handy tool in single women who come to us and want to conceive using donor sperms, or it could be a same-sex couple again who want to, try for a baby using donor sperm. So this is where these are some of the indications where IUI does come in handy. Right, what if we have to move into a cycle of treatment like an IVF or an ICSI cycle? How does it go? So what happens once a plan has been discussed and made by your consultant? We will bring you for your baseline scan. That baseline scan will happen on day 1, day 2, or day 3 of your period, let us say. We will do what we want to see is, do you have, all your follicles? Follicles are those little immature eggs, which we want to count them and make sure that everything's looking nice and quiet. And that's a good time to start giving you hormonal injections. Okay, so these hormonal injections encourage these follicles to start growing, and these follicles are the ones which are harboring the eggs in them. Hormonal injections, once started, go on for almost 10 to 12 days. Following, and along the path, you'll have about 3 scans to monitor your cycle. And the last scan, if you find the follicles have really grown, they've become mature, they're a good size, then that's when we trigger and you get ready for your egg collection. What do you expect from these medications? The vast majority, I must say, tolerate the injections really well, okay? But you can expect to have some side effects like headaches, mood swings. Some women are quite sensitive to progesterone, so they may have some breast tenderness, bloating. A very small minority may have excessive egg production, excessive hormone production, and they may have symptoms of ovarian hyperstimulation syndrome, okay? But we've got very strict protocols to try and avoid OHSS. So as I said, scans will keep happening. So, for about 10 to 12 days, we'll keep monitoring your follicles. Alongside, we're also looking at your womb lining if you're heading for a fresh embryo transfer, because we want to make sure that the embryo is now going into a beautiful receptive endometrium. Okay, after every scan, there'll be you'll sit down with one of the nurses who will make sure that you know how to do the injections. If you've got any questions about sharps, about something not quite agreeing with you, you'll have that the time to sort it out with one of our nurses. So as I said, final scan, if you find that on that scan everything's looking perfect, usually the trigger that we give is an HCG. Sometimes we have to give another medication like a GnRH analog, okay? You'll be given very detailed verbal and written instructions on how to get ready for the egg collection, what time you need to come in and all the rest of that. And on the day of the egg collection, you come into the operation theatre. So just around the corner behind, you'll find that, we've got a dedicated recovery bay. You'll have your baseline observations. The gentleman will go and give us a semen sample that goes to the embryology lab and they get ready. Okay, you'll get a chance to meet a lovely anaesthetists. So we've got a very dedicated team of anaesthetists who come in, and the egg collection that we do in our clinic is under deep sedation. So you get beautiful sleep for half an hour when one of the surgeons, let's say I'm coming and doing the egg collection transvaginally. The procedure takes about half an hour. Once you're back in the recovery, you had a chance to recover from the anesthetic effect. You've had a nice cup of tea, both of you are back in the bay. The surgeon will come and have a chat with you, will tell you what egg numbers we've got. So altogether, you're in the clinic for about 3 hours and then we let you go home. Okay. What happens from there? So this is just a pictorial depiction of how a treatment cycle works. So what most of the clinics, and our clinic included, what we do is known as a short antagonist protocol, right? And so let's say somebody's got a period here. So maybe day 1, day 2, day 3, we call them for a baseline scan. Okay, we commence the injections. It could be daily FSH, or it could be a combination of FSH and LH. Generally speaking, there'll be 3 scans to monitor the cycle. Okay. At the end of this, let's say everything's looking nice and ready. This is where we trigger with the HCG injection. Okay, 36 hours later, you're in the clinic for the egg collection. And following that, if you're heading for fresh transfer, you go home, you will start some pessaries, the progesterone pessaries, and all going well, you come into the clinic on the 5th day from the egg collection for your embryo transfer. Embryo transfer, you're in the clinic for maybe half an hour, 40 minutes. We do an ultrasound guided transfer. All right, off you go. And then approximately 2 weeks later, that is 16 days post the collection, you will be going for a pregnancy test, which you'll be advised to do on your own in the house and give us a ring with the result. All right, so that in a nutshell is how the cycle will work. Right, so what else do we do? So we also do what is certain other treatments like egg and sperm freezing. So this is These are reproductive techniques which are done for preservation of fertility. Frozen eggs and sperms are then stored in liquid nitrogen. Success rates remain really good. The thaw survival of these frozen eggs and sperms these days with the vitrification technique that we are using is close to 90 to 95%. So that's really, gone from, it used to be about 60%, it's now about 90, 95%. So that's really encouraging. Earlier, we used to say you can freeze it up to 10 years. Now, recent guidelines which have changed, you can store it up to 55 years with a renewal happening every 10th year. Okay, the reason people do it, we know that some people may not be in the, in that place in your life where you want to start a pregnancy or commence a pregnancy journey just yet, and you just want to store a few eggs or sperms as a backup. Okay, and we know that the younger the person is, the better the competence of the stored eggs. So we would encourage, couples, ladies, men to give that a thought earlier than later. Okay, there can be other reasons as well. Sometimes, somebody has gone through this family history of premature menopause. You might want to consider that earlier than later. Occasionally, we have women who have sadly been diagnosed with cancer. They are going to have chemotherapy, which we know knocks out the ovarian function. And before they undergo that, they might want to come and freeze eggs. Okay, AMH keeps coming back in the presentation. So AMH is a way of testing somebody's ovarian reserve. And alongside all that, as I said, be it IVF, ICSI, egg freeze, semen freeze, whatever, it can be a daunting task, and there is always supportive counseling. So you get up to 3 counseling sessions free with any of our cycles. All right. Okay, so we've got a campaign running at the moment called My Eggs, My Future. Maybe some of you have already heard of this. Why did this come along? I'm just going to take you. So what happened was, actually, this was one of my ladies, and I was just doing one of the fertility assessments, and I did a scan for her and actually found that her antral follicle count was really less. And she turned around and she said, I wish I knew that there was a concept called antral follicle count. I wish I knew there was something known as age-related decline in fertility. So it's comments like these which made us think, and we thought, look, maybe we need to get out there and speak a little bit more about, what is it? What is ovarian reserve? What can we do about it? So too many women were coming for treatment when it's too late. So we thought we need to educate people about the lifespan of their fertility preservation options which are available through egg freezing. Okay, we wanted the target audience we thought would be sort of in their early 20s, early 30s, late 30s even. This we launched in September 2023, this campaign, and it's really picked up pace. People like it, and it's an ongoing mission. What do we want to achieve? We want people talking, sharing, shouting about it, because we have the option of doing something about it, isn't it? So the long-term goal obviously is get more people talking about it, get them to freeze eggs and sperms in good time so that they can have the option of starting a family when they feel they're ready. So definitely, if you want to go, please go visit www.myeggsmyfuture.com, and you will see lots of interesting stories, inspiring stories up there, and lots of scientific information as well. One of the stories is of Kira's. Kira's was one of my colleagues in the clinic, young, bubbly, full of verve. And then when she just on a whim did her AMH and found that it was really, really low, initially she was shocked, but she came to grips with it, and she had egg freeze, a few egg freeze cycles with us. And she shares her story on the website with you. Right, so moving on. So when we've got the eggs out and we've got the semen in the embryology laboratory, what do my embryology colleagues do? So we want to fertilize these eggs, okay? And there are various methods. We've got a conventional IVF. IVF stands for in vitro fertilization. ICSI. ICSI stands for intracytoplasmic sperm injection, okay? So here you can see IVF would mean each egg is now left surrounded by a few million sperms in the petri dish. 24 hours later, we'll see, okay, if the egg has got fertilized with one of the sperms. That's IVF. So there's a bit of natural selection there. ICSI, if we find the semen parameters are not quite meeting the lab criteria, we want to give the sperms a hand. So what happens here is each mature egg is selected. It is held. Can you see that? This is the holding pipette. And with a very, very fine needle, a sperm is picked up the best looking sperm, let's say, and it's injected inside the egg. Okay, so we're just giving the sperms a hand to go and fertilize that egg. This is ICSI for you. PICSI is pretty much ICSI. It's just that we are selecting the sperms in a slightly more advanced manner by doing a little bit of a maturity testing for them. All right. So IVF is when we've got completely normal semen parameters. ICSI is, it could be because the sperm parameters are suboptimal. Either the count is less, more abnormal sperms, right? Or we've surgically removed sperms, which are more precious, and we need to do ICSI. It could be because of MAR positivity in somebody's semen analysis, which means they've got anti-sperm antibodies, which means the sperms stick together and they will not have the ability to penetrate the egg. We need to give them a hand, okay? Or if somebody's had, a previous cycle where they had unexpected fertilization with an IVF, we automatically will then offer them an ICSI cycle next time. Okay, I'm going to see if this plays. So you can see here, so lots of, sperms in the dish. And what the embryologist is now trying to do is look under the microscope, see, locate one good motile, normal looking sperm. All right. And then what happens, you can just keep watching. What you're seeing here is the needle. Okay, and this needle is highly magnified, but it's like the strand of my hair. It's really thin. Here we go. Yeah, there we go. And it's now been, we just snip off the tail. We suck that sperm into the pipette. All right. And now we've got the egg held by the holding pipette. Here we go. We are penetrating the zona. And within a second, you'll see we're getting the sperm ready. Here we go. This one here. We penetrate. One quick deft movement. We leave the sperm within the egg. And we're out. Okay, so ICSI has been there with us for at least 3 decades plus now, and it's been doing really, really well. It's a fantastic tool. So moving on, PICSI, as I said, certain indications where we do PICSI. I'm not going to run you through all the indications, but yeah, that is an option which is available, especially if somebody's got very low HbA, which is a test, as I mentioned earlier, which we offer in the clinic. Right, so whichever way we get to this, be it IVF, ICSI, PICSI, what you want to see 24 hours later is this beautiful 2pn stage of the embryo. Okay, when we leave them on day 3, they are known as cleavage embryos. You see multiple cells. Okay, they're all looking uniform, they're looking beautiful, something which is what we want to see. And generally speaking, we want to leave them a bit further so as to get to this day 5. So you can see a beautiful blastocyst. This is a stage where most of our embryo transfers will take place. At the blastocyst stage, you can see this beautifully expanded, almost hatching blast. Okay, you've got this little clump of cells, which is called the inner cell mass, which is going to form the baby. And you've got this single layer of cells called the trophoectoderm, which is forming the placenta. So that is the stage, most of the couples or single ladies, let's say, they want to come. And that's the stage of embryo that gets transferred. Okay, sometimes you might even say, find that they're really, really ready hatching to go and embed into that endometrium. Right, so a little bit more about embryo transfers. So the day of the embryo transfer will be based on the number of fertilized eggs and the number you'd like transferred. Right, our clinic specializes in the fact that we've got a 7-day running service. So we do embryo transfers even on Saturdays and Sundays, unlike a lot of other clinics where, one of the days or even the weekend transfers are not being offered. So that way we don't want anything coming in the way of, nothing coming in the way of a pregnancy happening, really. You will be given an opportunity to see your embryos on the screen. We give a picture for you to take away. Embryo glue is an add-on which the clinic offers. So basically it's hyaluronic acid, which embryos will sit in the embryo glue before we transfer it into the womb, and there are studies supporting the fact that this will improve implantation rate. So that's something that will be discussed with you when we are planning a treatment cycle. Right. So PGT, if you remember at the very beginning, we talked about what are the additional things that the clinic is offering. So PGT, some of you might have heard, stands for pre-implantation genetic testing of embryos. Essentially, what is known is that whether a cycle is going to give us a live birth, okay, in the vast majority, it boils down to the embryo quality. And by embryo quality, I mean the chromosomal normality of an embryo. Just by looking under the microscope, it's not possible for our embryologist to say, is this embryo good? Is this, something which is going to give us a live birth? So we've got this technology, which, mind you, HFEA still hasn't given a green light on its traffic light system, because they feel we don't have enough evidence to say that this is something which must be done for every couple. But there is enough evidence now saying that certainly certain subset of patients will benefit from this technique. And what's happening in this technique, as you can see, okay, once the embryo reaches the blastocyst stage, we decide not to transfer it fresh. We take a few cells from the trophoectoderm, and then we send it off to a specialized laboratory to see if this embryo is chromosomally normal, right? So results might come back, and if we've got, say, 5 blastocysts which were biopsied, results come back saying that actually 3 are normal, 2 are abnormal. Those 2 we don't waste time transferring, because they're not going to give us a pregnancy, or they will end up as a miscarriage, a missed miscarriage. So essentially what we found the PGT does for us is it reduces the time to pregnancy, and it definitely reduces the risk for miscarriages. Okay, so so PGT-A, so pre-implantation genetic testing for aneuploidy, which means chromosomal abnormality, is the most common. We also have the ability to offer PGT-M or PGT-SR, and this is specifically for couples who are carrying, let's say one of them is carrying a specific genetic mutation, and they would want to screen those embryos to rule out that particular mutation and then go for a transfer. So we do have that ability as well. Another thing which I must highlight is the IVF witness system. So, sometimes you hear this sort of scary headlines in papers about mixing of embryos and, things which go on, which vast majority of the clinics shouldn't be happening. But in our clinic, certainly we've got an IVF witness system. So what happens in this is that patients are given an ID card at the beginning of their treatment cycle, from which they retain from the egg collection to the embryo transfer. Okay, sperms, eggs, embryos, anything that belongs to them are electronically tagged. This provides traceability of all lab procedures. Procedures are carried out in designated witnessing stations, and so this system is like a reassurance to the patients that everything that we are doing in the lab, anything to do with your gametes, your embryos, is witnessed, so that the chances of anything going wrong become minuscule. All right, so that's something which we pride ourselves on. Right, so whichever the route, what you want to see at the end of this journey is a nice pregnancy. Like you can see here, you've got a beautiful pregnancy sac, you've got a lovely fetal pole, you've got a nice yolk sac, and I'm sure there would have been a nice heartbeat. We can also do a 3D scan. And we also offered, as I was mentioning earlier, the Harmony test, it was called. Now it's called the non-invasive prenatal testing. So our first scan following treatment is at 7 weeks. Okay, and after that, we sort of say goodbye to send you down the NHS route for further care. But if you like another scan at 10 weeks with a blood test to look at the Down syndrome risk, etc., which is the NIPT, we have that facility as well. Okay, so what else do we do? So as I mentioned earlier, we run the egg donation and sperm donation programs, right? So egg donation, somebody might consider because they are just old and they feel they don't have enough eggs, not competent eggs. Okay, somebody might have gone through early menopause. That means they've exhausted their egg reserve. Some women may have undergone chemotherapy, and because of which the egg quality is no longer good enough to give them a pregnancy. There may be some women who are born without ovaries, in which case they may have to borrow eggs, and that's through an egg donation program. Or it could be to intending parents who are undertaking a surrogacy journey. And I'll talk a little bit more about surrogacy in a bit. Sperm donation, again, either the individual is not having sperm production, has undergone chemotherapy, certain genetic disorders which knocks out sperm productions. It could be a single lady who's using donor sperms, or it could be a same-sex female couple who would like to try for a pregnancy using sperm donation. So lots of reasons why we thought running a program of egg donation, sperm donation absolutely makes sense. What is surrogacy? So again, something I'm sure you've either heard, read, or perhaps couples who've gone through surrogacy. So this is when someone agrees to become pregnant and have a baby for someone else. Okay, so two parties are involved. There is a surrogate, like in this picture you can see there is a surrogate, and there can be two intended parents. It can be two males, or it can even be a heterosexual couple where the female, for example, probably is born without a womb, or maybe she's got a womb which is or it could be a medical reason where she's been told it's too dangerous for her to carry a pregnancy by herself. Okay, often the only option. So surrogacy is when is the only option for women unable to carry a baby to term, and for male same-sex couples. Okay, there are two types of surrogacies: a host surrogacy or a straight surrogacy. We can deal a little bit more, when we do talk about surrogacy in a future consultation. So moving on. So we also cater to a lot of CCGs and provide NHS-funded treatment cycles. So some of the ICBs with whom we are currently liaising are these. So the reason I put up this slide was just, in case you are, so I often come across couples saying that, look, we are actually on the wait list with the NHS, don't know, how what time it might take. I say, just ask them if we are one of the referral clinics, okay, and since you've already got you're in chat with us, you've got a rapport with us, choose us, and we're more than happy to assist you with an NHS funded cycle. So we are also doing that. So these are some of the ICBs that we are liaising with. So we've got the Mid and South Essex ICBs, we've got the North Central London ICBs. But let's say there is no NHS funding. Is there any other way? Because couples, I do agree, it is an expensive proposition. So there are certain other ways, okay? We include programs like egg share. So it could be that, let's say there is a same-sex couple and she's got very good reserve. She says, fine, I would like to do an egg share cycle. So that is possible, whereby we can stimulate her, and whatever number of mature eggs we get then gets divided so that she keeps half for herself and half they get donated to the egg bank, okay, which can then be utilized for another recipient. But by doing so, the cycle's costs do get subsidized significantly. And similarly, a sperm share cycle can also work. All right, so if there's something like that, what are the steps? Pretty similar. Okay, you'll have screening bloods, you'll have scans like the saline infusion sonogram, and then we'll commence treatment with some fertility medications that I have alluded to. Our website gives you very clear-cut treatment costs. So there is nothing hidden. You have to be aware of what is involved. So the website very clearly mentions we've got a fantastic finance team, who are more than happy to take any phone calls, any question regarding finance. And even during the consultations, consultant will actually send you a cost sheet with treatments which are bespoke to you, highlighted in that. All right. So it could be a treatment like IUI, a cycle of IUI will be something like 1,250, or it could be, a cycle of Pixie, which is quoted as 5,540. So yeah, so the costs are all displayed, okay, and you can have a look, and if any doubt, talk to us. Similarly, we also do an egg-free cycle, so we've got a egg-free single cycle at 3,900, or we've got a 3-cycle package at 10,500. But just be mindful, we've got the medication cost on top of it, along with the screening blood cost on top of that. Okay. Right. This is the reveal. So what we've done is that all of you who are attending the open evening, okay, our new consultation, if you try and book, is £250, but we have discounted price of 125 for all those who can book by the 3rd of May. So this, remember, the full price is 250. you will be getting it for 125 as long as you make the booking before 3rd of May, okay, which is next Friday. All right. So this is just a consultation, mind you. The blood test cost and the semen analysis cost will be different. We liaise with another partner organization called Access Fertility. So some of you who probably visited the clinic, you'll see a sort of a board standing outside. So this is called Access Fertility. Okay, Access Fertility is liaising with various clinics in the country, and what they do is they offer packages. So they have 3 packages. They've got IVF Unlimited, IVF Refund, IVF Multi-Cycle. So if you think you would like to go with a package with Access, by all means, just pick up the brochure, give them a ring, and I'm sure they can help you out. The way this works is the payment is made to Access. Okay, the treatment is carried out in our clinic, so everything is still going to be under one roof. The medication cost obviously will be from wherever you purchase the medication. So most couples purchase the medication from our pharmacy. Okay, but if you want to purchase medication from outside, let's say I've got couples who are pharmacists themselves, we're more than happy to give you some external prescriptions. Okay, so that's about Access Fertility. Wellness at Herts is very, very important. We appreciate that it's a long journey. And we know that it might not be successful in the very first go. Okay, so we lay a lot of emphasis on emotional support, and you'll find that every individual, as you walk through the clinic, feels for you, is a part of that journey. We're all invested in that. And let me not say any more, you'll feel it, okay? But we also have other things happening. So if you go through our website, you'll find that there are a lot of little bits and bobs which will help give you those supportive vibes, okay? So do connect through that. Again, as I mentioned, commencing a treatment journey, you want to get into a pregnancy journey in the best of your health. So if you need any help through a dietitian, we will sort of signpost you towards the British Dietetic Association to find a dietitian. Okay, we will obviously, as we are talking, give you some steps as we go along to try and optimize that BMI, to try and optimize your lifestyles. Okay, so yes, diet becomes important. And that kind of brings me to the last of my slides. So why us? Okay, so we've got 34 years of experience. We've got a 7-day lab working. You have embryo transfers across, so there is no exception where we don't do embryo transfers. We've got a very robust electronic witnessing system. We've got more than 7,000 babies delivered through this clinic. You will find the support at every step of your journey. Okay. And of course, there's free parking. Who doesn't like free parking? Okay. And if you actually happen to come to the clinic, you will find that I love working here. I've got a fantastic team. That apart, if you come and see, there's a beautiful canal. We've got this beautiful ducks. It just is a nice atmosphere. Okay. So I'm not going to say any more. At the end of this, there's a link which we've sort of requested you to give us a feedback. Please feel free to fill in that little survey monkey link, okay? Because as I said earlier, it's extremely important for us to hear from you, okay? Any way we can make this presentation, these open evenings better, we'd love to hear from you for that reason, okay? You can follow us on social media on various platforms. If you want to book an appointment, you've got our phone line there. You've got you can drop an email to us. From what my admin team members tell me, we've got new consultation availability within the next 2 to 3 weeks. Okay, so do pick up the phone. Right. Okay. What I'm going to do now, I'm going to stop sharing this presentation, and I'll take you through a short video. It's like a tour through our clinic. Okay, there is beautiful music, I'm told, on that, but you might not be able to hear it. Okay, and at the end of it, I'll come back and but let me see if I can stop sharing and share this video tour of the clinic. Right. I hope you were able to see that. So that brings me to the end of this open evening. Thank you very much for staying with us till the end. I hope you've been sending your questions, and I'm sure Jackie and Mana have been, been busy answering those, and I will be joining them in a bit. Okay, so yeah, no, I look forward to seeing you in the clinic in person. I wish you all a very good evening, and yes, let's do this together. Thank you. Bye. Good evening, everyone.